I'm a board-certified diagnostic and interventional radiologist. Today, we have another installment of our popular mini medical school series where we break down complex topics into bite-sized pieces. And I'll tell you why this topic was actually requested more than once. So today, we're going to talk about rare types of stomach cancer that you have never heard of. We will cover the 3 types of stomach cancer that most people do not know about and why these cancers are important. Because although they make up less than 5% of all stomach cancer cases, they have unique features that can sometimes lead to misdiagnosis. We'll also cover the signs you shouldn't ignore, which we'll get to in just a minute, as well as how these cancers are treated. First, we'll start with some basic information about stomach cancer. Adenocarcinoma is the main type of cancer that most people are aware of. When it comes to stomach cancer, it originates in the glands that produce acid to help digest food. The incidence of stomach cancer has been decreasing in North America and Europe for several decades, but it is still more common in Japan and Korea. This is thought to be due to dietary factors, including consumption of salted and fermented foods, which can increase the risk of developing H. pylori infection. And we'll talk about that in a second. On the flip side, however, adenocarcinoma is increasing in Africa and Central and South America, possibly due to an increase in obesity and late diagnosis. Adenocarcinoma is usually present in the middle section of the stomach and tend to have a more indolent or slow course compared to the rare types we discussed today. There are 2 other types of gastric cancer that are far less common. Squamous cell carcinoma arises from the flatlining cells that normally line the inside of the stomach and are responsible for secreting mucus and digestive enzymes. These 2 types together account for approximately 95% of all stomach cancers. But remember, they can be quite different in terms of behavior. The 3rd type, sarcoma, grows from the connective tissue that supports and strengthens the stomach wall. Each of these tumor types has its own origin and distinct characteristics, which will be evident as we go through them. Now, let's jump into the first uncommon type, squamous cell stomach cancer. While adenocarcinomas arise from the inner lining of the stomach, squamous cell carcinomas originate from the flat epithelial cells found in the upper layers. Normally, these cells play a crucial role in protecting the stomach from digestive acids and other harmful substances. Here's the kicker. Unlike the more common glandular type, squamous cell cancers are not associated with H. pylori. Instead, they are linked to chronic inflammation and irritation caused by smoking, alcohol abuse, and a history of stomach surgery. They can also occur in people who have severe chronic reflux disease. That's pretty common, isn't it? But it's not that simple. You see, squamous cell cancers are tricky because they do want to always show up in obvious ways early on. They can lie dormant for years before becoming apparent. Many people don't even know they're at risk for these tumors until they start showing symptoms. And speaking of symptoms, here's the big problem with these cancers. By the time symptoms do emerge, the tumor has often grown and spread. So how do you spot these silent invaders? Well, let's take a closer look. As squamous cell carcinomas develop in the upper layers of the stomach, they tend to form masses. Here's the challenge. These masses can remain small and hidden for a long time, silently invading deeper tissues as they grow. This means that many people who have this type of cancer do not know they're at risk or that they have a problem at all until the cancer is more advanced, when they finally become apparent. Symptoms include pain in the upper abdomen, especially when eating, and difficulty swallowing or nausea. If these symptoms persist, it's essential to seek medical help immediately. However, even then, diagnosing squamous cell stomach cancer can be challenging because it mimics other digestive disorders. Here's why. Endoscopy, which allows us to directly visualize the stomach lining, is considered the gold standard for diagnosing stomach cancer. During an endoscopy, a thin, flexible tube equipped with a camera is inserted into the stomach through the mouth. However, this approach isn't foolproof. Even during endoscopy, early signs of squamous cell carcinoma can be easily mistaken for precancerous lesions or other non-cancerous conditions. And that's a big problem. In addition, traditional biopsy methods may not always capture the entire spectrum of the disease, leading to potential underdiagnosis. Plus, they're not good at staging or determining how far the cancer has spread. This is particularly problematic for squamous cell stomach cancer because it tends to spread rapidly to nearby lymph nodes and distant organs. Remember that time is of essence when dealing with cancer. The earlier it's detected, the better the chances of successful treatment. Unfortunately, the lack of accurate and efficient diagnostic tools for squamous cell stomach cancer means that many cases are diagnosed at a later stage when treatment becomes more complex and the outlook less optimistic. So what's the solution? Well, researchers are working on more sensitive and specific biomarkers that can serve as early warning signs for squamous cell stomach cancer. Additionally, they're exploring advanced imaging techniques such as enhanced endoscopy with chromoendoscopy and confocal laser endomicroscopy, which can provide real-time cellular images during endoscopic procedures. For those who don't know, chromoendoscopy involves using dyes to enhance the visibility of abnormalities in the digestive tract. Meanwhile, confocal laser endomicroscopy enables high-resolution imaging of mucosal lesions, providing valuable information about their characteristics and helping to differentiate between benign and malignant lesions. These advancements hold promise for earlier and more accurate detection of squamous cell stomach cancer, potentially leading to better treatment outcomes. Let's move on to the third type of rare stomach cancer, sarcomas. Now, unlike the previous type, sarcomas don't start in the epithelial tissues. Instead, they arise from the mesenchymal tissues, such as connective tissues, muscles, nerves, or blood vessels that support and connect various parts of the body. While sarcomas are rare in the stomach, they can be tricky because they often don't cause symptoms in their early stages. As they grow, they can push into the stomach cavity like a mass and cause obstruction or lead to abdominal pain, nausea, or vomiting. Other times, they can bleed and cause symptoms related to anemia like shortness of breath or fatigue. It's important to note that these symptoms are nonspecific and can mimic other digestive issues. Imagine trying to figure out if that pain in your stomach is just indigestion or something more serious. That's the challenge that many people face. When symptoms do appear, it may already be too late for a cure. At this point, doctors can perform endoscopy and biopsy to examine the tumor. The tissue sample can then be analyzed under a microscope to confirm the diagnosis. However, even with these tools, it can be difficult to determine how far the cancer has spread. Imaging studies like CT scans or PET scans can provide insights into whether the cancer has spread to nearby lymph nodes or distant organs. Surgery may be necessary to accurately assess the extent of the disease and remove the tumor. Here's the issue. Surgery for gastric sarcomas can be complex and challenging because these tumors often grow deep into the stomach wall and are difficult to separate from surrounding structures like blood vessels and nerves. This complexity adds to the difficulty of treating this rare cancer. Overall, gastric sarcomas represent less than 1% of all gastrointestinal cancers. Their rarity makes it harder to study and develop effective treatments, contributing to the limited understanding of the disease. Now, let us shift gears and talk about the common symptoms that should alert you to the possibility of stomach cancer. Persistent stomach pain is a red flag. It's crucial to pay attention to any discomfort in the abdomen that doesn't go away. While stomach pain can be caused by various factors such as indigestion or gas, constant or recurring pain warrants a checkup. Unexplained weight loss is another concerning sign. Losing weight without making any changes to your diet or exercise routine, especially when it comes to stomach cancer, could indicate the presence of a tumor. This is because cancer cells can multiply rapidly and cause weight loss. Changes in stool, particularly black or bloody stools, are also alarming. Black stools may suggest bleeding in the digestive tract, which could be a symptom of stomach cancer. Similarly, bloody stools indicate an issue in the gastrointestinal area that needs attention. Difficulty swallowing, also known as dysphagia, is another symptom that should not be ignored. Dysphagia occurs when food gets stuck in the esophagus, and it can be a sign that there's a tumor blocking the way. Remember, these symptoms don't necessarily mean you have stomach cancer, but it's essential to investigate any red flags promptly. Let's quickly wrap this up. Most of the research efforts and treatment strategies for stomach cancer have focused on adenocarcinoma, leaving squamous cell and sarcomas relatively understudied. However, recent studies are shedding light on potential targets for therapy in these cancers. Researchers are investigating the use of immune checkpoint inhibitors and targeted therapy to treat these rare stomach cancers. These approaches aim to stimulate the body's own immune system to fight the cancer cells or to precisely target the cancer cells while minimizing damage to healthy cells. While these therapies show promise, clinical trials are ongoing and the results aren't yet conclusive. Surgical removal remains the primary treatment option for stomach cancer, but it can be challenging, as mentioned earlier. Minimally invasive techniques such as laparoscopy are often used to reduce postoperative complications and recovery time. However, the extent of surgery depends on the stage and location of the tumor. If the cancer has spread to nearby lymph nodes or other organs, further treatment like chemotherapy or radiation therapy may be recommended. Squamous cell and sarcomatoid carcinoma of the stomach are rare, aggressive, and challenging to diagnose. Early detection is crucial, but remains difficult due to the lack of awareness and specific diagnostic tools. Symptoms often overlap with more common conditions, leading to delays in diagnosis. While current treatment options are limited, ongoing research into targeted therapy and immunotherapy offers hope for better outcomes for these rare stomach cancers. Thank you so much for watching. We hope you enjoyed this installment of our mini medical school series. If you've been enjoying our videos, please continue to support us. And if you liked this video, check out this related video on other rare cancers that doctors may miss.